Okay, Anuja, so would you like to talk about the interviews when you interviewed at Boston and all the students? Because Boston takes a lot of students, it's a huge number. So, how do they decide whom to choose, whom not, and what kind of students do they accept?
Boston is a batch of 100, so it's like not a less number. It is actually a big number. But the fact is that the group in Boston is very diverse. So they have, I don't know if there is a decided percentage of what ethnicity students will be there every year, but it's a big mix of, Middle Eastern population, Indians, Pakistan, Bangladesh, like all South Asians and Americans, Canadians. So it's a big group. And so it's very difficult to exactly say that what all Boston needs as a profile, but I know that it becomes very competitive as compared to, not as compared to others. Every school is very competitive, but with Boston it is more challenging because it's number one, it's only interview based. There is no bench test, or there is nothing other than an interview which actually, it's like a
Decide.
do or die situation. Yeah, to select it. So the selection criteria becomes very much difficult in terms of, like, you need to have like an exceptionally great GPA. And I know that people used to say that, oh, Boston prefers MDS, like masters and
I
everything.
used to think the
It's
same.
not that. Like, we had a lot number of students in our class who were not postgraduates. Many students who were fresh graduates, students who are graduates, they have been working like as a graduate for so many years. Many students who did some public health masters. And so it's not like an MDS will get in Boston. It's not a
But
criteria.
did you
But
have
of
like
course, it actually improves your profile, because as a person who has done residency, you have better publications, you have better experience, your clinical experience is more than others, and you have like been to many conferences, your C course credits, they increase and everything, right? So in that sense, obviously it gives you an edge, but there is no criteria as such. Oh, you are a master's, you will definitely get Boston, because many friends of mine who are MDS, almost similar profile as I have, they've been trying for so many years, they've not received anything from Boston yet. So
so does Boston also accept like fresh graduates who are right away from school, right after school?
yeah, even I, in our class, there were two people who were recent graduates.
Just two
And
out of
right,
100.
out of 100, yeah. So, but I won't say that there is no chance that if you are a recent graduate, you
Right,
cannot.
but minor chance, right?
Minor chance, yeah.
Okay. And then the other students were some people who done masters like in public health or other things like MBA, right?
Yeah, MBA, there were many people who did MBA, many people who did MPH, and there were many people who did residencies as well, like endo, ortho, grass, old medicine, perio. Yeah, so it was a mixed group, because the only thing is that I know that why getting into Boston becomes hard, because the interview, getting to the stage of interview, your profile has to be exceptionally great for them to even know that, oh, okay, this person deserves an interview. Once you have an interview doesn't shows you anything, right? If you don't perform well in interview, there is nothing else
Yeah.
which will make your chances more. You just have one chance.
Yeah.
But the interview in Boston is very general. It's not something that they are trying to test your knowledge, or they're trying to test like how much dentistry you know. They actually want to know you as a person. Even when I gave my interview in Boston, so I was like, talking to people around that, okay, so what to expect, what not to expect. So from that time till today, the answer is same. It's a very general interview based process. And you don't have to know that, okay, Krebs cycle, blah, 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 and how to make a composite, how to do a crown preparation, nothing like that. They want to know you, and how have you, what has motivated you towards dentistry, and why do you want to specifically come to Boston, and like, you have to tell them that what is special in you, which differentiates you from the other candidates, and they will take you.
Because
That's true.
sometimes I wonder, like, how do these 100 students, get well along with each other, and how do the teacher manages the class with such a big number? And how are your groups and everything? Like, if you wanna,
So our lectures are like all in one. It's a big lecture hall and with like multiple screens, just like in LLU, the lecture hall with like multiple big screens. And the good thing about is that even if you have a doubt, if you don't want to talk in the class, you can always email them, and most of the professors are very prompt in answering back to your doubts. And other than that, some of them will just take questions by the in the end of the lecture, before the lecture, or in between a break time. In our clinics, we are divided into groups of like 10 people per batch. So 10 people, and we have like two group practice leaders who are monitoring all your clinical progress. Even in our pre-clinicals, so some courses they divide the batch into half and half. So it's like 50 people. But on top of those 50 people, there will be like around 10 to 15 faculty who's there to guide you, and the course director is always there to help you. So I never had a problem in asking my doubts to anyone, be it preclinical, be it clinical, be it a didactic program, honestly. So I mean, they're managing it pretty well. I know it must be overwhelming for them
yeah,
because it's difficult. And
yeah,
also I think in a big batch like this, so there are many students who are better than you. Like,
yeah,
obviously in a big group, there are always people who are better in one thing and the people who are better in the
yeah,
other things. So I was very fortunate to be among people who had a lot of experience in
yeah,
clinicals. So they helped me a lot. So even if I didn't get a chance to ask my doubts to a professor, for example, I will have friends who will just guide me
yeah,
in the right direction. So I think that is very important. So in a big group like that, you get a lot of experience also,
yeah, true.
because everybody is a topper from their country.
Yeah,
Everybody has been a topper in their program. That is why they're sitting here in a very competitive program, right? So nobody is less than the other. It is just some people are good in something, the other people
yeah,
are good in some things. So it's always good to like connect with everybody in your batch and learn from whatever you can learn from the other person.
yeah. And how about the patients? Because it's such a big batch. Do you have enough patience for everyone?
I honestly didn't have to struggle much. Like, you know how in India sometimes we have to bring our own patients
Yeah.
because there is a certain criteria that you need this patient. So we used to go to like other places to find patients. I never had a problem like here. Even I used to think like, 100 people, how are they going to manage with the
Yeah.
patients? So in that sense, there is no problem with that.
Like,
Sometimes you will feel that okay, so it's already November, I'm graduating like next year in July, I haven't started this. So those kinds of things are always there, but PU has enough patience to give you, so you learn from them.
so did you have any particular criteria that you had to fulfill, or like a total production that you had to meet?
So it was not about the production, but it was about the number of procedures which we do in every course. Like for Remo, we have a certain number of dentures which we have to do, certain number of
And if you
composites which we
don't,
have.
so if you don't get patients, like for example, if you want to do like five removable, but you don't have five patients for removable, then how do you manage?
I have not seen even a single person who could not fulfill the requirements. Like I know that sometimes things happen because patients stop coming, and or they don't want to pay, so it falls apart. Patient
Yeah.
doesn't show up for the appointment. These things happen with everybody. Like it's not something which is
Right, right.
unusual. But Boston BU has enough patients. Like even if one patient is falling apart, you'll get another patient and you can just get started with that. Yeah.
Yeah.
I mean, I have not come across with anyone who could not finish because there were no patients.
Right, right, right. Like, because in our school we were also, California's population is very big, so we were always overloaded with patients. Like sometimes I would pray that my patient doesn't come, because they would come like 1 hour before the appointment. And so that's why I was wondering, because
Super
Boston
excited for
also,
the treatment.
Yeah, because Boston also has Harvard, right? And then such a
Now,
big,
Harvard, we have Tufts.
oh yeah, you have Tufts, right? And then you have 100 students here, then you might have 100 like in the regular batch,
Yeah.
right? So I was like, it's hard, but it's
Yes,
nice
also,
to know that,
I
okay,
will just tell you, like, obviously, we never had the feeling of being overloaded with patients. It
but
was
enough.
never an issue, but it was not even the feeling that we don't have anything.
Got it, got it.
You always have something to do, like that 1 year of clinical the whatever the criteria we have. So I mean, you can complete it and you can do much more if you want to, because you always have enough patients in your roster that even if you are done with the requirement, sometimes you do over and above what is actually required.
Right. That's
I
good.
remember like some of the students, like once they're finished with their, they sometimes transfer the cases because
Yeah.
they have done enough and they already have done much more than what is required. So they're like, no, it's better that I transfer this patient to somebody who actually needs it, and then I can just go ahead with the other cases. So
Mm.
that has never been a problem. Yeah.
You said so many good things about Boston. Of course, we all are biased about our schools, but
Actually, yeah, actually
yeah,
true. Like if you ask me about Punjab University, I will have like 1 million things to talk about that school.
yeah.
And if you ask me about
But
Boston,
tell me one thing that you didn't like in school.
in school, hmm, I never thought about it actually.
Really?
Yeah. Now that you ask me what you don't like in Boston,
I didn't,
I
what I
it
didn't
was
like.
difficult for me to adjust to the city in the beginning.
Hmm.
Very honest. And I was like, I don't think I can live here. Like I literally I hate Boston. I hate Boston. So all my friends, whoever you will ask them, are like, I hate Boston. I
So
don't
you
think I
still
can.
hate it or you hated?
No, I don't hate it now. I like Boston. Eventually,
Oh,
that city grows on you.
yeah,
But when I moved, I was like, no, I don't think so. I can live. I think I'll just finish it and I'll just go.
right.
But now, whenever I go to Boston, I really like it.
Yeah. There is one thing that I didn't like, and I feel nice that I graduated, and that is that you keep getting emails.
Oh, yeah. Especially the survey emails. I think, yeah, now that you have mentioned this, the thing I hated the most was the survey emails, because sometimes, when you have to survey about a course or something, you will have 10 things to tell that, okay, I want to tell them this, they should do this, they should do this, they should do this. But when the time comes to fill that email, it has so many questions with like 10 million thousand of questions. By the end, you reach to give your own comments. You're like, whatever, just
Yeah.
submit it and get done with it, because I have so much lab work to do. This is
Yeah.
the last thing I want to do. And those
But
are mandatory survey emails.
yeah, but some people might not be able to understand what we are talking about. So at the end of every quarter, they ask the students to do a survey to evaluate their instructors, like how
Yeah.
they did. So we have to like score them and write comments, good or bad, about them. Yeah.
Also, one more thing which I think it's now coming in my mind. So, because we are advanced standing, some of the faculty, they assume that because you have been doing dentistry in your country, they don't have to teach you anything. So I have also, like, I mean, doesn't didn't happen with me per se, but I have seen like some of the students, struggling because the teachers will say them, oh, you are a dentist from your country, you should know that. I mean, even if I'm a dentist in my country,
Yeah.
like I did this thing 10 years ago, or
Yeah.
probably I did not even do it at all in my country because I
Yeah.
did not get that much exposure. And I am here paying so much of tuition, paying so much of my, investing so much time and everything. So just to expect from us that we should know it all, that
Yeah.
is wrong. That
Yeah.
approach is wrong. Just because we are internationally trained dentists doesn't mean that we are. So if you are so confident that we know it all, why don't give us the license? Why to make us go through all this hell
Yeah,
to
yeah.
get the
We
license?
didn't have that actually, but of course, every school has different problems, right?
Yeah.
Yeah,
I
yeah,
mean, this was one thing which I feel that, some, not all the faculty, because some of them are, and if you tell them that, this is the first, because I used to tell them, this is my first time doing this in so many years.
yeah,
So I will need your help. So in that sense, they understand and they are very, like,
help-
very nice and very helpful. They will actually tell you like step by step. And some faculty, regardless, will tell you everything step by step. So I
Yeah.
really respect that kind of attitude that you are teaching, and this is a teaching hospital. Even if I know something or if
Yeah.
I do
I
know
would love to
something,
learn.
I would love to learn. I would love to
Yeah.
see that what tricks you have, or maybe
Yeah.
you can give me some tip to do it in a better way and a
Better way.
faster way.
Yeah, exactly. But one thing I really liked here, I'm sure you would have noticed that too. Like in India, like if we are working on a patient and then we call our faculty, the faculty will take like 100 hours to come and will have us wait, right? Either they'll be chatting with each other. Like
Yeah.
now it seems weird. Maybe that time it seemed very normal, but here, like you go and call the faculty and they'll come right
And
away.
they're just here. They're just here in a minute. And sometimes
Yeah.
you just stand up and they look at you and they'll come.
Yeah, they'll
And
come.
some of the faculties, they will just keep on, coming to you after every.
Us.
So we
Yeah.
had like two, three people in our school. After every like 15, 20 minutes, they'll just come and just make sure that everything is going well so that you don't have to come looking for them. But I'm sure like there were some faculty here also who were like that. They will just disappear or they'll just talk to someone, keep talking, not coming. But it was very less. Like
Less, yeah. And also they are like careful about the consequences if somebody complains.
exactly. I mean,
Yeah,
because here the patients will say more than
yeah,
anybody else. The
yeah,
patients will say, and patients is the top priority. Like
yeah,
they say that I have to leave, they will do everything in their power to finish it before the patient has to leave.
yeah, yeah, yeah. So a lot of things that I really liked here as compared to when we were in India, right? I'm sure it's improving every day, but still.
Yeah, I think so too, because it's been more than a decade that we
Yeah,
were in that environment, right? So a lot of things changed, and now I see there are so many dental clinics in India who have started doing digital dentistry and things like that, which I never. I mean, I was like, wow.
yeah,
They are doing things under rubber dam, using those garrison rings and things like that, which I started using here. I never knew about them in India. I never knew the importance of minor details
details. Yeah.
when we were doing general dentistry,
But
and
we always
obviously when
read.
I was in residency I just left everything.
Yeah.
But it's good to see that there are many clinics in India now who have started using that technology, and it's like nice.
Yeah, like we used to read about rubber dam in our books, but I never knew how it looks like how
Same,
it feels. So we always had to just cram everything.
same, yeah. And also with cast partials, I always read about major
Yeah.
minor factors, this that blah blah. But
Oh,
here we actually made those things,
yeah.
and it's actually very much easier and nice and very stable. So the thing is that there were so many things which I just learned in books there, but here I could actually see them in person and do it with my own hands. So it's great. It's great. That's what I told you. Like after residency, I was just lost the touch from general. So BU actually gave me a great chance to learn everything again.
Yeah.
I also wished some of the professors on Teachers' Day, because obviously it's not a thing in US,
Yeah.
but
Yeah, I
it's
know.
a thing in India. So I just
Yeah.
emailed them like some of the good professors which I like. So
That is,
yeah, it was nice. I miss them. I miss the faculty.
yeah. But it's okay. You're going to be in Boston, so you can be in touch.
Yeah, that's true.
So the last topic that I want to discuss with you is about the visas because you were in Canada and you are a permanent resident, right? But you're not a citizen yet.
No,
So you didn't have the option of TN visa.
no.
Okay. So you applied for your OPT. So tell people
OPT.
what
So one year you can work on OPT,
OPT.
and you can apply OPT once you finish your program. Like, but you can apply it in advance, like 60 days prior to finishing your program. But it's taking forever. Like the current processing time is between 3 to 4 months to get that OPT visa, and then you apply for your social number, and then you start working. And there are some states who do not give you a license before you have the social number. That's the problem. So
Really?
everything just gets
Oh, so
delayed.
you need your SSN before getting the license.
Yeah. Some
Oh,
of the states are okay with that. They will just let you apply without a social, and they'll just let you apply for the license, and they'll just give you the number. Once you have the social, just get them updated with that, and that's it. But there are some states who need your SSN
and then
before.
for SSN, you need your OPT approval.
Exactly.
But my classmates applied for OPT in April and they got it now. So it's even more than 4 months.
Yeah, it's crazy. It's
Yeah.
like annoying.
Yeah. So now is
I'm
August.
in the same process. That's the problem. Like I'm in the same process. I'm also waiting on my OPT. I don't know. I just pray every day that someday should be the lucky day that I
Yeah.
should receive it. But let's see. I mean, the immigration is overloaded and they're understaffed. I believe what I learn and what I hear from people that they're understaffed and
Mhm.
there are so many thousands of applications coming every day.
Yeah. So because you're going to work in Boston, did you already get your license or you're going to get it after your SSN?
I will be getting it after SSN. I already did all the paperwork, like because I kept everything ready
Ready.
because I just did not want to waste my time after because already it's a very long wait. So I always suggest everybody, like whoever is in my situation, at least know that what all you need so that once you have your SSN, just fill it up and submit the application. At least it will save you some hassle.
Right. And in case there is any mistake in your application later, it will take even more time. So make sure that you call them, right?
Yeah.
But
So
my
that is why it's
question is,
important to like be on top of it right
yeah.
now.
But my question is, how long does it take for you to get the license? Like, what's the time span?
I have no idea honestly about it right now for
Because it depends
Massachusetts.
on,
For
no,
Connecticut, it's like 2 weeks because I applied for the license of both the states. So
right.
Connecticut, they did not need SSN. So I already applied for my license and they usually take 2 weeks of processing time. But Massachusetts, they want your license, SSN and everything before they issue you a license. So I don't know how much time they're gonna take.
Because like California takes 2.5 months, then Michigan takes 2 weeks, Pennsylvania takes 1 month. So, they all are different.
I think Mass is also like it's 2 to 4 weeks, something in between that.
So with OPT, you have to work with the same employer.
I so when we apply for OPT, you don't mention that with whom you're working, but it's for the work visa. Like if somebody is like, yeah, sponsoring you for an H1, you have to work for them because obviously they are sponsoring your work visa. But OPT, because there is no restriction like whom are you working for, that is for you. So you get 1 year after your program to at least start working here. And next year, when you apply for H1, because it's a lottery system, it depends. Like if you get a chance to be picked up in a lottery, if you don't get that, then it's a fix because your OPT will be expiring in a year, and your H1B lottery you didn't get a chance to have that. So then it's up to you. Like you want to go back to Canada, start there, and then pay off your loans like from there,
So but,
or
but you can't continue with that the same employer if you're not picked in the OPT draw.
OPT, you will get it regardless because OPT is something which your school is going to give you the I
No,
20
no,
for
no.
OPT.
First year you get it, right? OPT. I'm talking about later.
Oh, the H1, the H1.
Yeah,
Yeah, I
H1.
mean, if your H1 didn't, I mean, if your H1B didn't get picked in the lottery, then you cannot work technically after your OPT finishes.
Oh, so you can't work, but
Right.
but you can work in community clinics, right?
Yeah, yeah. So that is another thing. So if you don't get a chance to be picked up in your H1B lottery, the good thing is that you apply for community clinics, which are like a lot of clinics, and they will anyways sponsor your H1.
Right, right. And also because my husband is into immigration, I hear a lot of people who want to move to Canada from US because they are very like tired of the immigration situation that's happening over the years, right?
It's forever. I think if I continue like here on an H1, probably I will get a green card when I will die.
Yeah.
They will probably keep that green card on my graveyard that okay, here is it. Now you're sorted. And I'll be in the heaven or hell, whatever, saying then thank you, USCIS.
Yeah, yeah. But as a Canadian citizen, I had the option of choosing TN visa or OPT. But because OPT takes so long and is so problematic, I chose TN visa. However, if you choose OPT, you save on taxes, like around 7%
Yeah.
taxes you save depending on the state.
Yeah. For 1 year, like yeah,
Yes,
you,
yes.
you
For
don't
the
have to pay like that much of taxes as you will have if you work on an H1. That's
yes,
true.
yes. But it's nice to be a Canadian citizen because that way you can be on TN visa, which you get at the border, and it's very easy.
Exactly, it's very easy. Like I honestly wish that I would have been able to finish my days for citizenship, but it's okay. Like life
Yeah,
happens.
still okay. Yeah. Any
And
other?
also, I think with advanced standing, I say this to everybody, and it's good to share it with people who will be watching this video later. Like, I feel that advanced standing program is not about just getting good grades or,
Yeah.
just getting good in your clinical skills or being a great dentist overall. I mean, it's all about our struggles and our challenges, our stories. If you
Yeah.
see around you in your own batch, every person had a story
Yeah.
that why they came here.
Yeah.
Like there is no reason. So if somebody asks you, okay, why did you choose to come to US? Probably nobody has an answer to that. Or they have an answer which they just want to keep it to themselves. Like
Right. Right.
why they chose to leave all the comfort and love and affection of their family and friends back home and they choose to come here struggle for their own existence. So I think that whoever is applying currently or trying cycle by cycle, it's just a matter of time. It's a rough phase, it will
Yeah.
pass, and I think whoever comes into this process will eventually get through this. So it's just like just hold on, like have some faith on yourself. And I hope like people honestly stop committing suicide or getting depressed because of this, because dentistry is not the end of the world. Like
Yeah.
honestly, it's much more. Life has much more than just being a dentist.
Yeah. And like what you mentioned before, I always talk about that with people that I, in these 2.5 years, I think I became a little bit of a different person because this school doesn't teach you dentistry only, it teaches you so much more. And you
Agree.
learn from your friends, from people who've come from different countries. Like your horizon broadens and your
Broadens.
perspective about things changes, right?
Everybody has had their own struggles, everybody has
Yeah.
had their own challenges or success stories or failure stories. So it's good to learn, know them,
Yeah.
and learn from them. It's so much of learning. Like
Yeah.
just dentistry is one aspect of being in a
Yeah. It's
dentist.
just one
Like you
act.
learn a lot about life.
Yeah.
I feel that I am a very different person than I was even
Yeah.
back home. And 5 years from now, like 5 years ago, I was a completely different person. But now I have become a very different.
Yeah. And
Somebody.
also they help you get soft skills,
Yeah,
Yeah, because a lot of people in Canada think that, oh, they just want the license, they'll do direct license and get the license, which could be a good option for moms or for people, who have a lot of other responsibilities.
families and more responsibilities,
Yeah.
and they know that they cannot move to a different country
Yeah.
altogether. I mean, yeah, I know that some people are very much into like, oh, I want to go in for American system. So sometimes when they ask me, I just try to guide them as per their current family situation. So I honestly sometimes I tell them that even if you stay in Canada, do the licensure, it will be good for you. Like you don't have to move all the way, leave your family and kids behind, and
Yeah.
just do it. Like because we had so many students with us in the class who were moms and dads and leaving their families and coming. I used to feel so bad for them that it's so much difficult to be away from your kids and your spouses and do a program which is so hectic and so mentally exhausting, but
Yeah.
still they're doing it. But if in Canada, if we have a chance of not doing that and still having a license, then why not apply for that?
Yeah.
However, dental school learning is very very different from what you learn in a simple licensure process, but then it depends upon
Yeah.
your own priorities, like what do you want in your life. That's a different thing.
True. And Anuja, what do you think? So many people ask me about references, and I always tell them references definitely work. You talk to so many students. What do you think? Like, should a student give reference? Should a professor? How does references work according to you?
So I have, if not more, at least 8 or 9 people this cycle calling me or texting me that please, if you can put in a reference, blah, blah, blah. I would honestly suggest that references do work, but it's not that every time it will work. Somebody refers you, that doesn't mean that the admission committee will be like, oh yeah, we got a reference, let's get this person in the school. References will help them to see your profile probably if they have missed on it. Because imagine like 2000 applications, I don't know what is the way they, filter, what are the filters and how they are able to make sure that out of those 2000, how many of them will go to the next step, then how many will go to the next step. So what I understood, so when I was in my program like for 2 years, I also put references for many people. Some of them did get in, some of them could not. And even after like 2 cycles and 2 times telling them that I'm going to refer this student, they still did not get it. So, what I know that your profile matters a lot. If even if I put, for example, your reference, they will be able to see your profile. But if your profile does not match up to their expectations, you can never get an interview.
Right.
So
Right.
it's not something that references doesn't work. It's not like references always work.
Yeah, because I had a reference from one of the professors from Boston University and I still was not invited. So I think they are looking for certain profiles that they want.
There is so BU, I think, is very competitive. So this is the thing that sometimes you talk to somebody and they tell you their profile. It is a very basic profile. Like, and with basic, I would say a decent total score, a
Yeah.
good GPA. Like not a great GPA, I would say, like not 4 or 3.8 or 3.9, but like a good GPA, like 3.4,
Yeah.
3.5. And they don't have any publications, they're graduates and things like that, and they still get it.
Yeah.
On the other hand, there are people who are, did their residency, okay, they published books, they published like 10 articles, and they have so many other awards and honors to their names, and they get in. So in both the cases, you don't know how they filtered it,
Yeah,
right?
but I
So
also think the presentation matters, how you
that is
present your case.
your CV, your statement of purpose.
Yeah.
So these things actually matter. Like even if, so I think GPA is one thing. Even if somebody has a low GPA, you cannot do anything about it
Yeah.
because that has been in the past now. You can't go back to your graduation and redo the exam and then your GPA will improve. You can't do that. That's not in your
But you
hands.
can
So
take ATAT, right?
what is exactly in your hands is TOEFL course and your other profile which you can build your CV. The more you will work on your things as a dentist and the more you would like to work on your profession, the more improvement will be there in your profile. That's
Yeah.
what I feel. But it is very difficult to say with the certainty that Boston will take these things like 1, 2, 3, 4, 5, because that is not going to happen.
Yeah.
And it is also impossible to say that, okay, if I'm referring like 10 people, 10 out of 10 will get it. Maybe 5 or 4 out of those 10 will get it.
Yeah.
Not like, but it's not for everybody.
True. Yeah, it's very difficult to understand how they accept students, but I would say just
I
apply when you have the best profile and in the best presentation.
presentation, yeah.
Yeah.
Because in schools who do not have a bench exam, it's even hard
Yeah.
because interview is the only thing and you are just coming in front with one-on-one faculty discussion. There is one faculty who's taking your interview. If they like you, you are in. If they don't like you, you're not in. So it's just one person, one day, and a half an hour interview, which is actually deciding your fate.
Yeah.
In schools who have like 3 to 4 days of selection process, there we can think that okay, so the
Yeah.
chances becomes even more.
More.
Even
Yeah.
with an average profile, and
Yeah.
with average profile, I'm like decent scores and everything, not
Yeah.
like a 3.1 GPA and you are expecting that your
Yeah.
profile is average. It's not gonna be. But
Yeah.
an average profile in a program with like 3 days of selection process, you have better chances because they see everything. They see your
Yeah.
clinical skills, they see your interview, and your overall profile. So
Yeah.
it's change.
Yeah, it was such an informative session, and I'm sure, Anuja, everybody just like me would have loved to listen to you. And you're gonna be such an asset to the field of dentistry, so your patients will be very lucky.
Thank you so much, Wrinkle, and I wish you all the best. You have also not, have had less challenges in life. You have gone through a lot things and a lot of struggles, and you have come out to be like a supremely exceptional person and a
Thank you so
dentist.
much.
So I think we all will survive eventually.
Yeah, we have to discuss all the cases that we will have now
Of
in the
course,
future, and then
that is a good way to learn also.
yeah, and also meet at CE courses and conferences.
Of
Yeah.
course, I'm looking forward to that.
Okay, thank you so much.
You
Thank
are very welcome.